Okay, I'm going to go with the paper. Good morning, I'm Clay, and I'm a third culture kid. I was born in New Delhi to parents from California, and I grew up in Bangkok and Singapore, attending international schools with students from around the world. I feel at home in other cultures, and my international network and experience define me. Okay. This upbringing, together with some formative global health experiences, inspired me to attend medical school outside the US. I just finished my first block as a medical student at the University of Sydney. Many of you are or work closely with health professionals who are educated internationally. The needs of patients are as diverse as the cultures and geographies in which they live, and the dedication to healing is a universal human pursuit. Those who have worked together with local healthcare experts and learners in a variety of settings are all the more experienced, resourceful, and open-minded to different ways of being, different views on illness and health, and to thinking differently about how to make healthcare better. Remember that while the US is a global leader in biomedical sciences, research, therapeutic technology, healthcare training, there are many areas for improvement as well. The US healthcare system and its medical education system is not the be-all, end-all. Australia, for example, spends about 9% of GDP per capita on healthcare, compared to 17% in the US. The life expectancy in Australia is 5th in the world, while the US is 31st. There is much to be learned from how healthcare is delivered around the world. I believe all people should have the opportunity to seek cross-cultural experiences. This includes medical trainees who will gain not only medical knowledge and diverse clinical experience, but also develop cultural humility, much needed in a globalized world touched by forces that divide us. Students will gain an appreciation of the global burden of disease and a personalized understanding of their responsibilities as health professionals. They can be positive contributors to making safe, effective, affordable healthcare accessible for all. International medical interchange is not without its potential risks and harms. We must be thoughtful about how to act responsibly and ethically, to protect the vulnerable, to be safe, and to always make decisions together with the community. Let's make two-way, equitable interchange an essential part of sustainable programs. Go where you are invited. Be a host as often as you are a guest. The conversation is shifting from mission-based aid to building capacity. Join this chorus so its song grows louder. I've had the opportunity to learn from some extraordinary people. These were the humble caretakers at the Umbrella Orphanage in Kathmandu, Nepal, who showed me how a healthy life depends so greatly on basic human needs like food, water, a safe place to sleep, and love. Daily care, nourishment, and life education are the foundation of well-being and life trajectory. International medical education has the power to emphasize healthcare as intertwined with the other aspects of human lives. I met Robert at a hospital called KCMC in the shadow of Mount Kilimanjaro in Moshi, Tanzania. Resources are used wisely, teamwork is paramount, and the reality of what illness is like for the vast majority of the world is ever apparent. Robert passed up a better salary and lifestyle in the city to train and serve in Moshi. He showed me personal sacrifice to better one's own skill and knowledge in order to help one patient at a time, true to the Hippocratic practice of medicine. In Ecuador, I met medical student David and his father, General Surgeon Dr. Hernan Sacoto. Dr. Sacoto traded high-paying cases to his colleagues in town so that he could provide surgical care in a mobile unit for free to those without access. The founder, Dr. Edgar Rodas Sr., believed everyone deserves access to essential surgeries and that healthcare is an integral part of human development. His son and the unwavering Cinturandes team continue that legacy. Dr. Sacoto and Dr. Rodas taught me that the value of doing the right thing for the right reasons and the meaning and joy it brings to life. International medical education has the power to personalize global health issues and cement them in the minds of students. The people I've had the opportunity to live and work with and form real friendships have been incomparable teachers. Precision education comes in many forms. Experiential learning with international peers is both personal and transformational. No doubt you can have experiences like this in your home country, but in an increasingly globalized world that is nonetheless more divided, exchanges can build a generation who see healthcare from a global perspective. So here's my challenge to you. How might we support and grow international interchange between medical learners. Let's grow the global third culture of medical education together. Thank you.